The growing effects of gentrification on healthcare in Austin, Texas. Gentrification in Austin negatively impacts underserved communities as it has led to rising property values, increased living costs, and therefore the displacement of poor populations. Rising housing costs have forced minority communities to move away from central Austin, the epicenter of services aimed at lower income and uninsured patients, leading to loss of community ties, cultural identity, and social support networks. The Community Health Worker Project would promote and highlight the importance of the employment of healthcare workers from the Austin community who know what it is like to live and seek care here. While gentrification may attract new business, many do not cater to the needs of existing residents. As neighborhoods change, essential services that were once accessible may be replaced by business more geared towards the incoming affluent population. This can exacerbate economic disparities, as the benefits of development may not be evenly distributed, meaning existing residents, especially those with lower incomes, may not see the same economic gains as incoming residents. This is illustrated by the fact that 7.8% of all Austin families live at or below the federal poverty level, and that number is only expected to grow. The community health workers would combat this by working closer to these impoverished and displaced communities and being fluent in their cultural norms and practices. Knowing what it's like to grow up in these cultures and in these neighborhoods. Feeling seen and related to can drastically affect how effective healthcare can be by making patients more comfortable with their caretakers, fostering more honesty and trust between healthcare workers and their patients. These CHWs also understand more of the struggles these patients face in cultural stigmas, transportation, and finances, all of which can largely be attributed to the gentrification that has taken place in Austin. As temporary migrants to the city of Austin for education, we contribute to the systemic and institutionalized problem of healthcare inaccessibility, rooted in gentrification. Despite healthcare inaccessibility being an extremely nuanced issue, gentrification has primarily negatively impacted underserved communities, causing rising property values, increased living costs, and therefore displacement of impoverished populations to eastern Austin. This has moved these groups away from accessible healthcare, and away from the neighborhoods they know as their home. Additionally, many individuals that belong to the displaced populations are a part of the Hispanic and Black communities, underscoring the dire need to provide culturally competent care.